Hi, one of the most important questions about epilepsy is epilepsy inherited? Is it genetic? And if I have epilepsy, will I pass epilepsy and seizures to my children? So it is important to note that epilepsy by itself is not considered a major genetic disorder. It means that if you have epilepsy, in the general population, epilepsy is about 1 to 2%. And if you have epilepsy, the chances of you passing epilepsy to your children, if you alone in your family have epilepsy, is about 2 to 4%. So in general, the majority of patients, more than 95%, will not pass epilepsy to their children. And there are certain syndromes and occasions where the diagnosis is genetic, and if you have epilepsy, you will pass it to your children. And those are more likely in cases of generalized seizures, generalized epilepsy, and if epilepsy starts in the children or in teenagers and with certain syndromes such as juvenile myoclonic epilepsy or some of the certain epilepsy syndromes. And it is important to note that if you have epilepsy, your children might be a little bit more susceptible to epilepsy. I mean, if you have family history of seizures and epilepsy, you hit your head, you might be having more risk of developing epilepsy than other people who have the same hit to their brain. And lots of studies studied the correlation between epilepsy and the siblings of people with epilepsy, and sometimes even they have like abnormalities on their EEG without even having seizures. It can happen because the genes build the brain and they control everything in what the brain works. So now we have tests that we can do, genetic testing, to diagnose those types of seizures and epilepsy. So for example, we have an epilepsy panel that we have all the known epilepsy mutations, and we can test them for the presence of epilepsy genes, and that will tell us if you have epilepsy and what is the cause. Knowing epilepsy cause is important because we can plan treatment based on the mutations that we find. For example, if somebody has sodium channel mutation, then we can give them sodium channel blockers, and that can significantly help their seizures more than any other epilepsy medication mechanisms. So now we have a whole science of pharmacogenetics, which we plan the treatment, the pharmacology, based on the genetic makeup of some patients. One of the great examples is that we have some mutations in the calcium channels, and instead of giving seizure medicine, we give antihypertensive medication, anti-blood pressure medication that is designed to block calcium channels like verapamil, and that can be a seizure medicine because it can block the calcium channels and stop the seizures. So now there is a big science and lots of research going into knowing the genes behind epilepsy to better plan treatment. So if you have epilepsy and suspecting epilepsy syndrome or gene, you can test the genes, and if the gene panel does not reveal the diagnosis of epilepsy, we can do now a whole exome sequence and looking at the whole exome and the whole genes makeup of somebody to find the mutation that are responsible for seizures. And this is very important because now it is more affordable than ever before. Do you know that the first whole exome sequence and whole genome mapping costs anywhere between $500 million and $1 billion? And now you can do a whole exome sequences for less than $300. And this is a revolution in the genetics and in the neuroscience research and treatment, because now if we know the genes, we can plan the treatment much better. And to know more about the epilepsy medications and where they work on the neurons and how they work and how they help with seizures, you can see this video. And don't forget to subscribe to stay up to date on all the new videos about epilepsy and seizures, and see you in the next one.